Do you think that the other issue might be the ability to manage it or understand it or choose it? I would suggest that perhaps some of the larger businesses would have, I mean, someone like a Ken, you know, who knows everything and gets great information and goes out there and shakes the trees and finds out what's happening and then finds a plan. Well, I know, having been in small business, that you clean the toilets, you balance the books, you sell the product, you stock the product. When do you have time to do this? How do any of you have any idea on how we can help small business comply and therefore lower costs for large and small businesses as well?
Yeah, well, I think I was reading somewhere that something like 70% of the people that are uninsured are actually working people. So they're working in small business. So as I think about it, first, if you're a small business, just from competing for talent, I mean, the ability to offer or have access to healthcare, I think would allow you to be more competitive in terms of talent. I think that the most significant thing coming out of this for small businesses would be the exchanges. I mean, the opportunity for them to be in a pool that would essentially require that health plans compete for their business would result in their costs being driven downward. So I mean, I would think that as a, you know, if I was a small business operator, that I would look at this as being a very positive thing in terms of access to talent, in terms of the ability to actually provide health care and have it at a reduced cost.
If I may bring one little piece of experience, I often substitute for Bob Brinker on Money Talk. And on Saturday, we did a program on small business. And the small business who called in were extremely upset that they might even have to participate even on a default basis. I understand what you're saying, and I completely agree with it from a theoretical perspective. But out on the street, I don't quite see the backing there. Any help from any of you?
Well, the only thing that I would say is one of the biggest challenges in this debate from kind of the person on the street is it's very difficult to understand. It's very difficult for them to understand how it will impact them on a small business level, on an individual level. So, I mean, I think simplification of the message, but also even as we look at how to roll this out, I mean, I think it has to be simple, and people have to be able to get their arms around it and understand it.
Yeah, and I would just add this whole premise of small business versus big business always disturbs me, because if what we characterize as small business in this country is not successful, it doesn't matter what big business does, because the majority of business in this country emulates from small business. And I do think that the small business, I know for a fact, the Small Business Administration and other groups have been very vocal, have been very loud, have been very supportive, as Greg said, of exchanges, but not everything that they have been advocating for has materialized yet, and we're still holding out some hope. And I'll say that from a Bay Area Council perspective, and what the Senate, you know, what we end up finally, because we've got to have balance on both of those. You know, the Safeways, the CHWs, the Kaiser. I mean, we have staying power, but I think it's, you know, our priority is to make sure that what I think represents the majority of business in this country, first and foremost, is strong and is very viable, and I think will give lift to the broader business environment.
We have about 2 minutes.
Say two other things on small business. First of all, is small business owners are also entrepreneurs who have a challenge getting insurance themselves. If you've ever tried to get on the individual market and purchase an insurance policy, you know how difficult that is. So as a owner of a small business, having the opportunity to participate in these exchanges as a guaranteed issue with an exchange that has viable products is a big benefit. The second thing I'd say is I would be careful about taking the pulse of small business by listening to only Washington-based small business representative groups. If you actually listen to the individual owners and talk to groups that are actually polling what small businesses think, like Small Business Majority, who's represented here, they actually have a much more favorable view when they understand what's going on.
Very good. Very true. Now, you have a choice. We can take one question from the audience if you're willing to stay 5 minutes beyond 1:50, or we can end this. What's your choice?
questions.
Oh, they got that end look on their face.
They got the end look? All right.
Oh, yes, thank
All
you
right.
for giving us that option. If I could, and
Certainly.
I would like to say one thing, and that, everybody in this room has a perspective on healthcare reform. I'm not sure, I've not met the person yet that would say, that has said, everything that I've heard I just love. Let's just put it in. And this whole debate reminds me of the annual fight that my wife and I have each year, and that is that she likes 11-foot Christmas tree. There's only one male in our house to carry that tree. So I finally get the tree on my back. I get it in the living room. I begged her, plan out where you want the tree. I get it inside, and I think we got the spot. And she says, no, I think it'll look better over there.
Well, sure.
And I start in that direction, and it's no, that's not going to fit there. We're going to need to put it here. And I'm just kind of getting shorter and shorter and shorter. And eventually, I collapse. And I think our healthcare system is, there is a symbolism in what I just said. Whether you like it or not, and whether you think reform is a good thing or bad thing, one thing that there is no debate about, the professor would tell you that, Ken would tell you that, and everybody here, and you should know this. Our current system, ladies and gentlemen, is not sustainable. It will collapse, and it will bring this country to its knees. So I think everybody in this room, you got to voice your opposition, but we've got to get this thing started. And no, it's not going to be perfect. No, I'm probably not going to be 100% happy, and I'm sure you're not neither. But I think the justification for reform is clear, and I think it is unfair and unrealistic that this is going to be perfect. I remember when Medicare was introduced, the CBO did an analysis of it, and within 3 years, it was 3 times what it cost. And we survived that. And we will survive reform. And yes, we want to get it right, but we need your help and your voice. We've got to do this.
Excellent summary. I think we should all be very, very proud of the people on this panel for their thoughtful comments. It's clear that this is a process, not a product that we're looking at. And I hope that we'll have many more conversations of this sort coming up. So thank you to every one of you and to all of you.